Arkansas has the highest heart attack and stroke death rates in the nation, according to the Centers for Disease Control. We are 64% higher than the national average. Cardiovascular disease is the leading cause of death and disability in Arkansas, and there are risk factors for heart disease that you can control. I sat down with Dr. Chad Rodgers and Michelle Rupp, both with the Arkansas Foundation for Medical Care, to discuss. We're going to talk about heart health today.
Yeah.
And kind of two different tracks to think of. There's preventable heart disease, there's congenital heart disease. And let's start with your story first, Michelle, because it's a powerful one.
Sure.
When did you first realize you had a problem?
1983, actually. So I'm gonna take it way back. We're going old school. But I noticed that my heart would race, and that's the only way I knew how to describe it. Now, it wasn't until December of 2005 it was actually diagnosed.
Oh, wow.
Yes.
So like 12 years, or 22 years.
Quite
later.
a few years before it was diagnosed. The big problem, though, at the time was it was never captured in the moment. So I would have all this description of what I'm experiencing with this racing heart, but it never happened at a doctor's office or anything like that where you could stethoscope it or EKG it and find out what exactly was going on. And it wasn't until after I had finished a 5K in December, my heart was out of rhythm, and that lasted almost about an hour and a half, actually. So the race is over, I'm at home, and I'm thinking, gosh, my chest just still hurts, my heart still hurts. Maybe I should go to the ER. So I did what any normal thinking person would do and jumped in the car and drove to the ER.
Right.
And so I didn't need an ambulance.
Which is ill-advised.
Right.
Exactly.
Never advised that.
You were done racing, but your heart was still racing.
Correct. And when I went into that emergency room and they took my pulse, my heart rate was 208 beats a minute.
Oh, wow.
And that got some attention.
Yeah.
And so it was at that moment, then finally, it's being captured in the moment. It was determined almost immediately that I had Wolff-Parkinson-White syndrome. This is early December, and I had a procedure scheduled for April.
Oh, wow.
In 2006.
How common is this?
You know, it's pretty common. It's not one of the most common of heart disease, but we were talking about this earlier, that a lot of people will have experienced these symptoms, and you know, especially as you're kind of going along, you just think that it's normal because this is what you do, and sometimes it will reverse on itself. It's when it's kind of gone on for prolonged periods of time that people become more concerned about it. And sometimes people will get kind of lightheaded or they don't feel well. It's hard for them to kind of continue doing the normal things that they do, but it's like a kind of such a high heart rate that they can't quite adjust to it.
Mm-hmm.
What was the outcome for you? Where are you today in terms of what happened since that December of 2005?
I had a procedure in April of 2006. So this April, I'll celebrate 14 years, and I'm fine. They had to do what's called an ablation. So they basically burned on my heart. It was an electrical problem. And so I had several extra electrical wires that would send the impulses to tell my heart to beat. Mm-hmm. They had to sever those wires, and they do that with burning. And so how am I? I'm great. I no longer have a cardiologist. I've completed 18 marathons. I've completed a 50K. I don't know how many half marathons, and have not had any problems since. And that is, in my case, that's the prescription.
Yep.
Once they sever that connection, then you're cured.
What a great story. Let's talk about preventable heart disease. Arkansas has the highest heart attack and stroke death rates in the nation, 64% higher than the national average. Why is that?
You know, probably again, it's a lot of our lifestyle. You know, we have of course, people, as far as diet, smoking is a huge contributor to heart disease. But I think also, you know, just being sort of an inactive culture, people are not getting out and physically walking, running. You don't have to be a marathon runner. You're actually just walking or swimming or just doing something to help.
Sure, I've got some family members that would say shopping is a good form of walking exercise there.
It definitely is exercise.
Yeah. But we definitely have a high rate of high cholesterol, high blood pressure, obesity, diabetes, all these things that sort of contribute to vascular disease that lead to early heart attacks, lead to early vascular disease in your hands and feet. So, you know, it's sort of addressing those issues, as well as, you know, a lot of those things that contribute to those diseases being, those social determinants of things. We have a lot of poverty, we have poor access to health, so people are not going routinely to their physician for kind of preventable things, to check their blood sugar, to check their blood pressure, and to check their cholesterol. So those are all sort of important things to preventing heart disease.
Yeah, I'm sorry, go ahead.
Well, I would just add that in my specific case, this was something that was only detectable with an EKG. So it wasn't something you were going to necessarily hear with a stethoscope. I had a pre-beat before the regular heartbeat, and so that would not be something that would be regularly identifiable on a yearly checkup.
Yep. Let's talk about the modifiable risk factors. I know over the last 20 years we've learned more about what can be done to prevent things. We've learned more about ways to control diabetes, is one example of what you mentioned there. Where do we kind of stand with how that gets disseminated to the public these days? How do people learn more about if they want to manage their heart health a little bit better? Where do they go for that type of information?
Right, so I think regular routine checkups with your primary care provider. Your primary care provider should kind of annually see you, check your blood pressure, check your cholesterol, check your blood sugar, make sure those things are within control. I think it's, when you're, of course, like, I feel healthy, but when I went to my doctor a couple months ago, my blood pressure was way high, my cholesterol was out of control, my blood sugar was like borderline, but I felt fine. But now I began to take steps to sort of address those things. It's hard being 48. I didn't realize this was all going to happen. I've always been a healthy person who has ate well and exercised. So it's so important to just take that time, your personal time, some self-care time, to take off and go to the doctor and get those screens done. We talked about, a lot of Michelle's symptoms. Just taking the moment, an EKG is really not that big of a deal. Like if someone would have just listened a little bit more and thought, well, why don't I just send her over for an EKG? Things might have gotten picked up a little bit earlier, but it's hard to know kind of in the course of things.
Sure.
Yep.
And if I may add, also listen to your body. You know what's happening.
Oh yeah.
I knew what was happening. I knew something wasn't right. I didn't know what that was or necessarily how to articulate it I certainly couldn't articulate it in medical terms, but I knew something wasn't quite right.
Yeah.
And so it was constantly going back and saying, something's wrong here.
You want to guard against being a hypochondriac at the same time. Better safe than sorry at times like that. Let's talk about some of the social determinants of what can cause poor heart health. You mentioned earlier, Chad, that we live in a state where there is a high poverty level. Disease can be an influence on this. Are there policies that are in place? Are there things that should be in place that could address some of those systemic problems that are going to lead to community health and individual poor health?
Yeah, I think the biggest thing is probably access to health care. I mean, I think we did a huge favor to the state of Arkansas by expanding health insurance to a lot of people in Arkansas who didn't have it before. A lot of those people are living in poverty, and they don't necessarily, they're maybe 30 minutes to an hour away from a physician or to a hospital. So I think those are things that were great steps. I think also the things that we have done to try to control tobacco use, increasing the age in which kids can access, we don't want them to access cigarettes, but increasing the age in which you can buy cigarettes and stuff like that have a huge impact on preventing people from starting to use tobacco, which is a huge contributor to cardiovascular disease.
I know AFMC well enough to know AFMC has got some programs in place
right.
to try to do things to raise awareness about heart health. Tell me what you guys have going on.
Well, I'll start too,
Go ahead.
because I think it's pretty innovative. I mean, we had the Million Hearts 2020, which actually, went into barbershops and places where people go. I don't like to go to the doctor, even being a doctor, but you go get your hair cut, right? You go to the beauty parlor, or you go to the library. It's kind of common community centers where there would be like screening for blood pressure and also have some education materials available to them to get their the kind of those screens done that we'd like to see, particularly blood pressure screening. My favorite is the Bless Your Heart campaign, or as we say in Arkansas, bless your heart. So it's just a faith-based initiative to encourage, a lot of people will go to church, but they're not going to go to the doctor, but they can it's a good place to get materials and education and find out information about their health, as well as maybe do some screenings, maybe do some cooking classes, some education about nutrition.
Church is a pretty trusted community center.
Very trusted,
Yes.
Yeah, it is. is. So, all right, well, you guys have been great. And if they want to learn more about some tips or some things that they could do, where would you recommend that they go?
afmc.org.
All right, it's pretty easy.
Lots of good materials there.
Yeah,
Yes.
Michelle and Chad, thank you both
Thank
very
you,
much.
Rob.
Good
Thanks
to
so
see
much.
you.
Good to see you.
Welcome back.
Thanks.
So,
Good to be
Chad,
back.
Good to see you. All right. That's all for today's Talk Business and Politics. I'm Roby Brock. We'll see you next time.
When homemade is too good to keep at home. Helping Arkansas business do business. Making better happen with First Security.
You'll find us at the end of a lot of long country roads, covering over 60% of the great state of Arkansas. Our 17 electric distribution cooperatives are working day and night to provide reliable, affordable power to over 500,000 homes, farms, and businesses, just like yours. The Electric Cooperatives of Arkansas, your local energy partners.